repeat for me his January 26th? Okay.
And that's the electrode placement, VNS removal.
Okay.
Okay. And then the second date is January 30th.
Okay.
That's the tentative date. That will only happen if we have enough seizures and get the information we need to do the resection surgery.
And on January 26th, how long is that surgery?
Surgery working time is about 2 hours, give or take. Total time away from you is about 4 hours. And then Dr. Baumgartner's favorite line about the operation on the 30th is it's going to take as long as it's going to take to get the job done the right way. For most patients, they're in the operating room at 8, and we're usually done between 4 and 6 p.m.
Okay.
And that allows time for an intraoperative MRI scan. And as far as done for our working part, that might be us walking out of the operating room and the MRI scanner coming in for the post-op scan at 4 o'clock, or we may be completely finished with everything by 4. So that's kind of a rough estimate for length of time, about 8 hours.
Okay.
As far as recovery for the second surgery, that really depends on what they find in regards to where your seizure onset area is and what our resection is going to be. So if it is just a temporal lobectomy, particularly right side, are you right-handed? Okay, that'd be perfect. That's like if you're looking for a money ball, that's it. Non-dominant hemisphere temporal lobe, that's golden. Most of the time, the adult patients recover very, very well. We've had some go home at 2 days post-op, and some are as long as 5 days. It just really depends on how you do for pain control and how well you're eating. If we're working frontal lobe, the question is, how close are we to what causes you to move on the left side? And are we going to temporarily impact movement on the left side, requiring inpatient rehab? And we don't have that information at all until after they have the seizures, see how they spread, and then if they need to, they'll also do mapping. And they can figure out where your motor area is inside your brain in relationship to where your seizure onset zone is. So it's kind of up in the air. So it could be as long as 2 days, or it could be a longer stay requiring inpatient rehab. It's a huge range of